Hello friends, Assalamu alaikum. Today we will talk about the fluoroquinolones, which is one of the important class of the antibiotics. And fluoroquinolones are known as bactericidal agents because they kill the bacteria. So fluoroquinolones are synthetically prepared and they are the derivatives of the nalidixic acid compound. So when we fluorinate the nalidixic acid compound, so we get various fluoroquinolones. So what is nalidixic acid? Actually, nalidixic acid is a urinary antiseptic. It means that it is used to treat the various urinary tract infections. It is effective against gram-negative bacteria like E. coli, Proteus, Klebsiella, Salmonella, Shigella, but unfortunately, it is not effective against Pseudomonas. These all are gram-negative bacteria and they cause the urinary tract infection. Pseudomonas also cause the urinary tract infection, pulmonary infections, soft tissue infections, bones and joints infection. Nalidixic acid is available with the brand name Nogram in the tablet and syrup form. In the tablet we have 500 milligram which is used TID 3 times a day, and syrup we have 250 milligram for 5 ml. What is the mechanism of action of fluoroquinolones? How fluoroquinolones kills a bacteria? So take the example of gram-negative bacteria. This is the double-strand DNA of the gram-negative bacteria. So whenever there is replication of the DNA, so the double strand of the DNA must be uncoiled. So you can see here, this is the uncoiling of the DNA strand started, but at the end there is the formation of supercoiling, super twisting. So for removing the supercoiling or for the removing the twist, we have a DNA gyrase enzyme which help in the uncoiling of the DNA double strand. The DNA gyrase enzyme is also known as topoisomerase 2, which is found in the gram-negative bacteria, and this enzyme is responsible for the untwisting of the supercoiling of the DNA. So what happened? Fluoroquinolone actually inhibit the DNA gyrase enzyme. So when the DNA gyrase enzyme is inhibit, so it will not work. It will not uncoil the DNA. So what will happen? No replication will occur, and bacteria will die. So that's why they are known as bactericidal agents. uh, this is the double strand DNA of a gram-negative bacteria. During the DNA replication, there is the untwisting, uncoiling of the DNA double strand, but at the end there is the formation of supercoiling, because in bacteria there is circular DNA. So at the end there is supercoiling, super twisting. So to remove that supercoiling or super twisting, we have the DNA gyrase enzyme present in the bacteria, and this enzyme is responsible for uncoiling the super twist of the bacterial DNA. So fluoroquinolone inhibit the DNA gyrase enzyme, and thus there will be no uncoiling of the DNA strand, and there will be no replication, so bacteria will die. So in the case of gram-positive bacteria, fluoroquinolones inhibit topoisomerase 4. Topoisomerase 4 help in the separation of daughter DNA strand. So when there is a DNA replication, so multiple copies of the daughter DNA is formed. So for the separation of the daughter DNA strand, we have topoisomerase 4 enzyme, but fluoroquinolones in the gram-positive bacteria inhibit topoisomerase 4 enzyme, so there will be no separation of the daughter DNA strand and bacteria will die. So what is the pharmacokinetics of the fluoroquinolones? Pharmacokinetic means what does body do with drug. Actually they are well absorbed when used orally. Take the example of ofloxacin and levofloxacin. They have almost 100% bioavailability. Bioavailability is the amount of drug reached to the systemic circulation. So almost ofloxacin and levofloxacin reach 100% to the blood. Food can reduce the absorption of the fluoroquinolones. Calcium, iron, zinc, antacid syrup, they reduce the absorption. And fluoroquinolone distribute to all tissues, even to all fluids of the body. Moxifloxacin excreted through bile. So if a person has renal failure, so we can use moxifloxacin because it is favorably excreted through bile. But in the case of gemifloxacin, dose should be adjusted if a person has renal failure, because it is completely excreted through kidneys. Adverse reactions of the fluoroquinolones, they include the GIT disturbance, hypersensitivity, photosensitivity, and there is also tendon rupturing. Diarrhea, nausea, headache, dizziness, tendon rupturing. Fluoroquinolone also cause the QT prolongation, so they can induce arrhythmia. Fluoroquinolone also can induce Fluoroquinolone can also induce seizure. They can also cause the peripheral neuropathy and photosensitivity. Classification of the fluoroquinolones: we have first generation, in which we have the nalidixic acid, which is active against gram-negative bacteria, except the pseudomonas. We have second generation. In second generation we have ciprofloxacin, norfloxacin, and ofloxacin. Unfortunately, ofloxacin is also not effective against the pseudomonas. Ciprofloxacin and norfloxacin are commonly used to treat the diarrhea and UTI. They both are used in the smooth muscle infections. Ciprofloxacin is available with the brand name Novidet. 250 mg tablet also available, and 500 mg tablets also available. In the third generation we have levofloxacin, commonly used antibiotic, available with the brand name Levoflox, 250 mg and 500 mg tablet. It is also active against pseudomonas. Levofloxacin is commonly used to treat the skin infections, throat infection, chest infection, UTI, and typhoid. In the fourth generation, we have moxifloxacin and gemifloxacin. Moxifloxacin is available in the 400 mg tablet, which is used once a day (OD), and gemifloxacin is available in 320 mg tablets, which is also used as OD. Moxifloxacin is commonly used to treat the diabetic foot ulcer. So this was all about the fluoroquinolones.